Hi, I am Tiffany All, and I'm going to be using MAR3 today. So, the first thing I would want to do when administering medications to my patient is I would want to pull up the provider order, and I would want to pull up the medical administration record and have my medication dispensing machine. So I'm going to check the provider orders, and I'm going to first check and make sure that the provider order matches all the orders that are in the MAR. And then my second check is I'm going to pull out all my medications, and I'm going to make sure that my medications match all of the orders that are in the provider order and in the MAR. So everything matches. So what we're going to be doing is we're going to make sure that we have our 6 rights of medication administration. We want the right patient. We want the right medication. We want the right dose. We want the right route. We want the right time. And then everything is documented correctly. And so then what I would do from there is I would have my cups. I would make sure that everything I needed I had. I go over to my patient's room. Good morning. My name is Tiffany. I am your nurse today. It is time for your medications. Can I please verify your first and last name and date of birth? And I would check that against their wristband or the medical record. And I would perform my hand hygiene. And I would put on my gloves. And while I'm doing that, I would ask the patient, do you have any allergies that I need to be aware of? And this is to medications, to food, to if you have seasonal allergies or any hypersensitivities that I need to be aware of. And if they said no, I would also want to make sure, because they are going to be taking an antidepressant, I want to make sure, have you had any MAOIs in the last 14 days? They said no, then I would ask them, okay, have you had any alcohol or any grapefruit juice? Because that is contraindicated in your atorvastatin, which is your cholesterol medication. And if they said no, I would say, okay. And then, so now that I have those things checked off and they don't have any allergies that aren't listed in the medical record, I would do my third check with the medication. So I pull up their medical record. I would make sure we have, okay, glyburide 3 milligrams. We have Wellbutrin 100 milligrams. We have levothyroxine 100 micrograms. We have amoxicillin 250 milligrams. We have acetaminophen 500 milligrams per 15 mils. We have our docusate sodium, and that is 100 milligrams. We have our atorvastatin, which is 10 milligrams, and we have our temazepam, which is 15 milligrams. So we have all of our medications, and they all match. And so then I would go ahead and I would do my physical pre-assessments. So like for the glyburide, you want to do a blood glucose check because it is a diabetic medication that is going to stimulate the pancreas to secrete insulin. So you want to make sure that you know what their sugar levels are. You want to, any time you do any kind of treatment on a patient, you want to do a full set of vitals, which includes their blood pressure, their heart rate, their respirations, their temperature, and it's always good just to listen to their lung sounds anytime you're doing anything that is going to mess with chemicals in their body. So you're going to want to do that. So we have all of our pre-assessments done. And so now we're going to start. I normally would not be administering all these medications at the same time. So I'm going to go through them, but they would be at different times throughout the day. So the first thing I would do is I would get the glyburide, 3 milligrams, and I would let the patient know this medication is for your type 2 diabetes. It's going to get your pancreas to release some insulin for us. And now some common side effects with this medication are going to be fatigue and heartburn. But something that you would want to let the doctor know is if you're having any like hypoglycemia, or some fast irregular heartbeats, you want to report that to the doctor right away. So I would put the medication in my cup. I would give it to my patient before breakfast with a full glass of water. So they would have that. And then the next medication I'm going to administer again is the Wellbutrin 100 milligrams. This medication is an antidepressant, and what it does is it reduces the reuptake of norepinephrine and dopamine. And so I would let my patient know that, and then I would also want to let them know some common side effects of this are like a little bit of stomach upset or some nausea. But something that you want to report right away is if you are if you have darkened urine or if you have a fast and irregular heartbeat. And so then I would ask if they had any questions. I'd pop it in the cup, administer the medication with their water, and then I move on to the Synthroid, the levothyroxine 100 micrograms. This medication would also be given before breakfast. And with this medication, I'd let them know this is for your hypothyroidism. This medication is a thyroid hormone replacement since you're not producing enough of the hormone. And with this medication, it's likely to have some diarrhea, and this one also could make you gain weight. Some adverse effects that you would want to report with this one is any yellowing of your skin or eyes. If you notice that it's yellow, that is something that you want to let us know like right away. So this one needs to be administered with a full glass of water. So I'll pop it in here. My patient their medicine. Have them drink a full glass of water. And then the next medication is the amoxicillin, and it needs to be administered with food. So with this medication, you can have some stomach upset and some diarrhea because it is an antibiotic. The way this medication works is it actually it breaks down the cell wall of the bacteria, causing cell death. So you have it with food. So I'd give them some crackers, pop that there, and some things that you want to watch for is if you're starting to have severe diarrhea, that could be C. diff. That's something you want to let us know, or if you're feeling any kind of allergic reaction, let us know right away. So I give medication with water, and then the next medication that I'd be giving is the acetaminophen, 500 milligrams per 15 mils. I would want to check their pain on a scale of 0 to 10, with 10 being the worst pain they ever experienced. Or if I'm giving it due to fever, I would already have their baseline fever because I took their vitals. And so what this medication does is it is a pain blocker, fever reducer, and it works by reducing fever and blocking pain receptors. So with this medication, you could get a headache. You could actually experience fever if you didn't already previously have a fever. And then some adverse effects with this medication would be if you take too much Tylenol, anything over 4 grams a day, you could have acute kidney failure. So that is something that you would definitely want to report to us right away. And that's also something I would check in your MAR to make sure. So with this medication, you want to place your cup flat. We're going to be doing 15 mils, so we give them that 500 milligrams. We want to get down, make sure we can see the med. We would pour it to the 15 mil line. Okay, and you want the concave to be at the 15 mil line. So then you'd want to take your towel, and you'd want to wipe around the lid. Your hand is holding the label, so that way if there was a spill, it's not going to smear the label. And then you administer that, let them drink a little bit of water. I'm talking fast because my last video ran out of time. So the next medication that I would be giving, these would be in the evening. I would want to go ahead and give the Docusate Sodium 100 milligrams. This medication is for constipation. What it does is it draws water into your colon to help soften your BM. This medication could cause some nausea, some mild cramping. An adverse effect with this one is if you have any swelling of the face or tongue, that is an adverse effect that you want to let us know. Also, if you get any hives, that's not what we want. So you get your cup, you pop it in, they don't have any questions, you administer your medication with your water. And the next medication I'd be doing again is the atorvastatin. This medication is for your cholesterolemia. What this medication does is it reduces your LDLs, which are the low density lipoproteins, and it increases your HDLs, which are the high density lipoproteins. So this medication is the one that you don't drink alcohol and you don't have grapefruit juice. This medication could cause some GI upset, and an adverse effect is hepatotoxicity, which you would want to report to your doctor right away. Also, if you have like muscle cramps or muscle spasms, you want to report that right away. And so then pop it in there, give it to them, some water. And then the last medication is our benzo. This is temazepam, 15 milligrams. This medication is a central nervous system depressant. You want to make sure that you know their level of consciousness and that you also have their vitals for this one, which we did. This medication works to help with insomnia. It could also work for anxiety, but with this specific medication, it's more for to help get you to be able to sleep. And side effects of this one are drowsiness and dizziness. But adverse effects of this one is going to be that central nervous system depressant. So if you're feeling like confusion, agitation, irritability, those are things that you want to report to us, because it's just supposed to be to help you sleep, not to make you irritable. And so then we would give them, make sure they don't have any questions, give them their pill with some water. And I would, again, when I was done with everything, I would assess their vitals to, see, to make sure that everything was good. I would take off my gloves. I would perform my hand hygiene. I would document everything that I did, and then when I redid the vitals, I would go ahead and document all the vitals and the patient's reaction to the medications. Is there anything that I would make sure that the patient has their table, that they have their call light, everything that they need with them. Their cell phone, I would let them know if they need me, just go ahead and hit that call light, and then that would be that.